Chronic low back pain, or CLBP, is a persistent pain condition that affects millions worldwide. It's defined as pain located below the ribs and above the gluteal folds, lasting more than 12 weeks. This condition is not only physically challenging but also impacts daily activities, work, and overall quality of life. The causes can be specific, like an injury or disease, or nonspecific, where no clear pathology is found. Importantly, CLBP is now recognized as a complex issue involving not just physical but also psychological and social factors. This means that effective treatment must look beyond the body to address the mind and environment as well. Let's explore how modern approaches are making a difference. Chronic low back pain is the leading cause of disability worldwide. Its persistent nature means that many people experience recurring symptoms, sometimes several times a year. This leads to increased doctor visits, missed workdays, and significant medical expenses. The burden is not just personal, it's a major public health concern with wide-reaching socioeconomic consequences. As the prevalence of CLBP continues to rise, healthcare systems are seeking more effective and sustainable solutions. Understanding the full impact of CLBP helps us appreciate the urgency for better management strategies. Additionally, chronic low back pain has been managed with a variety of physiotherapy approaches. These include exercise programs, manual therapy, and patient education. Exercise can range from general fitness and strengthening to specific trunk muscle activation and even aquatic workouts. Manual therapy and mobility exercises are also common. While these methods can help, they often focus mainly on the physical aspects of pain. However, many patients continue to struggle with pain and disability, highlighting the need for more comprehensive approaches that address the psychological and social dimensions of CLBP. A neuroscience education, or PNE, is a modern therapeutic strategy designed to help patients reconceptualize their pain. Unlike traditional education, PNE explains the complex neurophysiological, neurobiological, and psychological mechanisms behind pain. Using metaphors and analogies, it helps patients understand why they hurt and how pain is processed in the brain and body. The goal is to reduce fear, anxiety, and misconceptions about pain, empowering patients to take an active role in their recovery. PNE is often delivered alongside other treatments such as exercise or manual therapy for maximum benefit. PNE targets several key factors that contribute to chronic low back pain. These include pain intensity, disability, kinesiophobia, the fear of movement, and catastrophizing, exaggerated negative thoughts about pain. By addressing these elements, PNE helps patients break the cycle of pain and avoidance. The education is tailored to each individual, often using stories and visual aids to make complex concepts easier to grasp. The ultimate aim is to foster a better understanding of pain, reduce fear, and encourage healthier movement and coping strategies. There's no single way to deliver pain neuroscience education. It can be provided individually or in groups, using presentations, books, or brochures. Sessions may involve interactive discussions, visual aids, and practical examples. The flexibility of PNE allows it to be adapted to different clinical settings and patient needs. Some well-known resources include the book Explain Pain and the Therapeutic Neuroscience Education Guide. The key is to ensure that the information is accessible and relevant, helping patients relate the concepts to their own experiences. Pain is more than just a physical sensation. According to the International Association for the Study of Pain, it's an unpleasant sensory and emotional experience. This means that our thoughts, emotions, and environment all play a role in how we perceive pain. Disability, kinesiophobia, and catastrophizing are common in CLBP and can worsen the experience. By teaching patients about the true nature of pain, PNE helps them see pain as a complex, multifaceted phenomenon, one that can be managed with the right knowledge and strategies. Kinesiophobia, or the fear of movement, affects over half of chronic pain patients. It leads to avoidance behaviors, increased disability, and heightened pain sensitivity. Catastrophizing, on the other hand, involves persistent negative thoughts that exaggerate the threat of pain. Both factors can trap patients in a cycle of fear and inactivity. PNE specifically addresses these psychological barriers, helping patients regain confidence in their bodies and reduce the emotional impact of pain. This shift is crucial for long-term recovery and improved quality of life. Previous reviews on PNE for chronic low back pain had limitations, such as small sample sizes and language restrictions. With new randomized controlled trials published in recent years, researchers saw the need for a comprehensive, up-to-date review. This systematic review and meta-analysis aimed to consolidate all available evidence, providing clearer guidance for clinicians and policymakers. By including more studies and participants, the review offers stronger conclusions about the effectiveness of PNE in real-world settings. Review followed rigorous guidelines, searching multiple databases for relevant studies up to June 2025. Only randomized controlled trials involving patients with chronic low back pain were included. The researchers assessed the quality and risk of bias for each study using the P-DRO scale, ensuring that the findings were reliable. Data were extracted on pain, disability, kinesiophobia, and catastrophizing, with results analyzed at the end of treatment and at 1 and 3 months follow-up. This thorough approach strengthens the validity of the conclusions. Review included 15 randomized controlled trials from countries around the world, with a total of 810 patients. The average age was about 44 years and 61% were women. Most studies compared PNE combined with exercise or physiotherapy to standard care or other therapies. Some studies delivered PNE alone. Assessments were made at 3 key time points, immediately after treatment and at 1 and 3 months follow-up. This diverse sample provides a broad perspective on how PNE works across different populations and settings. Methodological quality of the included studies was generally good, with an average PDRO score of 6.8 out of 10. Most studies had some risk of performance bias, mainly because it's difficult to blind participants and therapists in educational interventions. Some also had selection or detection bias. Despite these limitations, the overall quality was sufficient to draw meaningful conclusions. Recognizing these biases helps us interpret the results with appropriate caution. Meta-analysis found that pain neuroscience education significantly reduces pain intensity in patients with chronic low back pain. This effect was observed immediately after the intervention, and the benefits persisted at 1 and 3 months follow-up. The reduction in pain was measured using standard tools like the numeric pain rating scale and visual analog scale. These results suggest that PNE can provide both immediate and sustained relief when integrated into treatment plan. Beyond pain relief, PNE also led to significant reductions in disability. Patients reported improved ability to perform daily activities, as measured by tools like the Roland-Morris Disability Questionnaire and Oswestry Disability Index. These improvements were seen at the end of treatment and maintained at 1 and 3 months. By addressing both physical and psychological barriers, PNE helps patients regain independence and participate more fully in life. Fear of movement or kinesiophobia is a major obstacle for many with chronic low back pain. The review found that PNE significantly decreased kinesiophobia both immediately and at follow-up points. This was measured using the Tampa Kinesiophobia Scale. By helping patients understand that movement is safe and beneficial, PNE encourages more active lifestyles and reduces the risk of further disability. Catastrophizing, or the tendency to magnify the threat of pain, was also significantly reduced by PNE. This effect was seen at the end of treatment and at 1 month follow-up as measured by the pain catastrophizing scale. Lower catastrophizing is linked to better coping, less distress, and improved outcomes. By changing how patients think about pain, PNE helps break the cycle of negative emotions and disability. PNE is thought to work by changing the way the brain processes pain. It helps replace old maladaptive pain memories with new, healthier ones. By improving pain knowledge and self-control, patients experience less pain and fear. Repeated sessions help consolidate this information, making the benefits last longer. The more patients understand their pain, the less likely they are to avoid movement or catastrophize, leading to better overall outcomes. Clinicians can incorporate PNE into treatment plans through short, structured educational sessions. These sessions use metaphors, stories, and patient-centered discussions to explain pain mechanisms. PNE can be delivered individually or in groups, supported by resources like Explain Pain. Research suggests that 2-4 sessions of 30-60 minutes each are effective, especially when combined with exercise or manual therapy. The flexibility of PNE makes it suitable for various clinical settings and patient needs. The evidence for PNE is strong. There are some limitations. The number of studies and participants is still relatively small, and there is some variability in how PNE is delivered. Some studies had risks of bias, and long-term effects beyond 3 months are not yet clear. Future research should focus on standardizing PNE protocols, increasing sample sizes, and assessing outcomes at 6 and 12 months. This will help confirm the long-term benefits and guide best practices. Pain neuroscience education is a valuable addition to the management of chronic low back pain. It effectively reduces pain, disability, kinesiophobia, and catastrophizing, with benefits lasting up to 3 months. Clinicians should consider integrating PNE into their practice, using patient-friendly materials and interactive sessions. Combining PNE with exercise or manual therapy may enhance outcomes even further. As research continues to evolve, PNE is poised to become a cornerstone of biopsychosocial pain management. Summary: pain neuroscience education represents a shift towards more holistic, patient-centered care for chronic low back pain. By addressing both the mind and body, PNE empowers patients to understand and manage their pain more effectively. The evidence supports its use as part of a comprehensive treatment plan, with lasting benefits for pain, disability, and psychological well-being. As more research emerges, PNE will likely play an even greater role in helping people reclaim their lives from chronic pain.